Hi, everyone. Cassie Thiel here. I wanted to talk to you today about Aravind Eye Care System. It's a fantastic healthcare facility treating eye care conditions in southern India. They have multiple tertiary hospitals and many, many outreach clinics. And they're really trying to eradicate unnecessary blindness for southern India. And they've really done quite a bit with sustainability. Uh, Originally, it was really focused on social and financial sustainability, and the work I was able to do with them kind of helped illustrate just how much of an impact that's had on their environmental sustainability. As a precursor to all this, I just wanted to let you know that I have some financial disclosures. I have a consulting business, so I work with many companies. None of these should be relevant to my presentation about Aravind. Aravind has a lot of really interesting infrastructure that they've built up around this, and I think this is key that you need that scaffolding to be able to have pretty solid environmental stewardship that lasts for a long time. And Arvind's invested in things like solar panels to kind of decrease their need for fossil fuels in their electricity sources. This helps too, replacing or potentially replacing their backup generators, which were typically diesel. Um, for wastewater treatment, hospitals in India are mandated to, they're required to have wastewater treatment facilities on site since the public infrastructure is a little weak on this front. And Arvind's Pondicherry location opted to have a constructed wetlands. And so these plants here are actually growing and filtering out, cleaning the wastewater from the hospital. And it creates this great ecosystem around the hospital. The hospital itself has many ways of providing passive ventilation and natural light. This is an inner courtyard. It has some grating on top so animals can't get in, but it really filters in this great natural lighting and you get a lot of air. This is also true within the hospital where you have these green spaces in these courtyards that are accessible to everyone, patients and staff, or Americans visiting and trying out their saris. All of these green spaces really create some great ecosystems for the much needed biodiversity that, we've been experiencing quite a bit of loss. So this is some sort of lizard in Aravind Pondicherry's wastewater treatment facility. So pretty cool habitat that they've been able to create. Um, Again, these are some of the other courtyards that are visible from patient units in areas around the hospital, but they're also growing their own food on site. I do not know how much of their food is produced here versus brought in from other locations, but they have a garden that their staff can tend to, and this does supplement the food that they serve to their patients. Now, all this infrastructure is wonderful, but as we all know from carbon footprinting of healthcare systems, a large part of the footprint of a healthcare system is really coming from your scope 3 emissions, which are your indirects, right? So all the things that you're buying, the way that you throw them away, your investments, those kinds of things. And Aravind, realizing that, supplies are a major part of operating room expenses, has gone a long way to optimize their operations and to really make it very efficient, so that more patients can access the care they need. And so some of the things that they've been doing, um, well, you can see here it's a little bit different from what we typically see in the US or in Europe. This is one of their operating rooms. This was prior to the pandemic, but what you notice is there are my hands over here. So 2 patient beds per surgeon, and there's actually 4 beds in this particular operating room. And they therefore are sharing a scope. The phacoemulsifier, all this capital equipment is shared between 2 beds, instead of needing one for each bed. The surgeon is only doing cut to close, and the moment the surgery is done, they wipe off their gloves with a antiseptic gel, and they flip all the equipment over to the second bed where they can start operating on that patient. Meanwhile, the first patient, gets their eye shield on and is taken out, and a new patient is brought in and prepared on that bed. So the surgeons can be extremely efficient going back and forth between the beds. The other thing you'll notice from this picture is that there are a lot of reusable supplies here: caps, masks, gowns, scrubs, blankets. All of these things are launderable. and typically are not changed until the end of the day unless they've been soiled in some way. There is a disposable patient face drape, but it is the size of a patient's face, so appropriately sized draping, and that gets thrown away between each patient. And they do have, of course, sterile instrumentation, which are maintained on a back table that's paired to the operating table. So they have a really efficient system here with a lot of processes in place to ensure that there's safety. And I think that's important to note. So I'm kind of hiding some of the metrics here. But Aravind's outcomes are well documented, and they're actually better than the US average for these surgeries. So it's not a safety and infection control risk. Now, some of the other things that Aravind has been very particular about, the physical layout is important. They've really optimized the surgeon's time, being the person whose salary is most expensive in the hospital. And given that they have such specialized treatment for actually operating, they want to make sure that that surgeon can be operating as much as possible, and not waiting for patients to come in or waiting for instrumentation and things. So they've paid attention to the physical layout of their space and the flow of patients through that space so that these high value resources, if you will, the surgeons are not waiting around for things to happen. And likewise, with the same idea in mind, they've really engaged in what's called task shifting. So instead of making the surgeon do all the pre and the post-operative work, they've essentially outsourced, if you will, those tasks to mid-level ophthalmic professionals. So these are nurses. This is actually a totally separate program that Aravind engages in to encourage education and training for local women. I could go on about that particular thing, but the key here is that they're training these young women on how to be nurses and scrub techs and a whole bunch of other roles within the hospital. And then they have those women doing the job that the surgeons in the US and Europe would otherwise be doing. So the surgeon can focus on just cut to close, while the patients are guided in and out of the room by these mid-level ophthalmic professionals. The other thing here, some of the other operational things that Arvind's been really good at is standardization. And this is something we struggle with in the US for sure, where we like the professional autonomy of our surgeons. And unless the institution has a really strong culture around standardization, each surgeon could even have their own custom pack. But at Aravind, everyone operates with the same instruments all the time. There's not a lot of variability, at least for cataract surgeries. So that really helps streamline processes, right? It's really clear what needs to go into what bins and how many of them you need for the number of surgeries you have coming up. And it also reduces the amount of wasted effort, right? If everyone's using the same instrumentation, you're never going to have a case where one surgeon's only using one item in a whole pack. And on that front, they've really tried to reduce their waste and maximize the reuse of items. So you already saw the personal protective equipment and how that is reusable. They reuse or multi-dose most of their drugs, and therefore they waste very, very little drugs and other medical supplies throughout the day. So those things that are somewhat disposable, they really try to get the most use out of those things. And finally, last but definitely not least, they are really clear in their mission that they're trying to provide care to people who could not otherwise afford it. And there's no sense in doing these surgeries if you're not going to do them well, from any of the sustainability perspectives, social, financial, or environmental. And so safety is of key concern for Aravind Eye Care System. And they are very clear, very particular about delineating those sterile field from non-sterile field activities, and making sure that the sterile instrumentation cycles in and out appropriately in the operating rooms. And it goes a long way to improving their outcomes. And to think about it from the environmental lens, this is from some of my work there in 2014. You can see two giant bags of trash from the United States for one phaco emulsification. That's one cataract surgery. And from Aravind on the right side of the screen, we have about 4 bags of trash, and that's for almost 100 cataract surgeries. So it's very clear visibly here that the resource consumption is extremely different between these two procedures, and they are the exact same procedures. They're using same instrumentation, same techniques. And when we did a carbon footprint of this and compared it to the United Kingdom, where there was an existing carbon footprint, we found that Aravind emitted about 5% of the greenhouse gases for the exact same procedure. And remember, their outcomes are actually better than the US. So clear learnings here. There's a lot that can be improved, and this is cost effective as well as environmentally great.